Okay, there we go. Well, a very, very warm welcome and good morning to Elisha Berridge, who's joining us this morning. Elisha, a very impressive CV. And just to say that you know all of this because this is your life's work. Graduated from UCT in 1995, started working immediately at a private practice where you focused on industrial hearing screening testing. And it was followed up 2 years working at the National Health System in the UK. You then returned to Cape Town and have been working in private practice. You joined Francis Slubber in 2008 and have a very special interest in adult rehabilitative audiology. We're a group of 5 audiologists with rooms in Wynberg, Claremont, Tokai, and Fishhook. And you're married with twin girls. I tell you, that's a full-time job on its own, who do, I'm sure, keep you very busy. And in your spare time, and here's the impressive part, you enjoy running and completed 12 Two Oceans and 8 Comrades marathons. Well done. Gee whiz. So very, very warm welcome. And Elisha, as an audiologist, maybe just orientate us in terms of what an audiologist does.
Well, thank you, Karen, for having me on. An audiologist, yes, is there to test hearing, diagnose hearing loss, but it's also a little bit broader than that. It's not only about fitting hearing instruments. We'll look at the patient as a whole. We'll help assist with difficulties. There's also balance problems that we may look at, or tinnitus. So it's a broader range than just only having your hearing tested and fitting hearing instruments.
Right. So, you know, our focus as an organization is the empowering of caregivers that take care of loved ones that have been diagnosed. And that's all types of dementia, be it Alzheimer's, vascular dementia, Lewy body dementia, etc. We know that people with dementia are very reliant on sensory stimulation and sensory interaction and engagement. And that becomes more and more prevalent as the disease progresses. But when we look at the early stages of dementia, is there any link that is known between early memory loss and hearing loss?
So I think if we look at what happens when we age, and you know, hearing loss is, if we look at what hearing loss due to normal aging is called presbycusis, and it's one of the most common conditions affecting older adults. And it's estimated that about half of the people between the ages of about 60 and 70 years of age experience some kind of hearing difficulty, and this can become debilitating. When we think about hearing loss, what a lot of people will often think of is what's actually happening at the level of the ears. But what we don't actually realize is that what's actually happening above the level of the ears is actually just as important. So that neural pathway actually has to be intact and functioning well for people to actually be able to process that information. So is there a link between hearing loss and dementia? Yes, there has been. Studies have proven to show a link between hearing loss and dementia. There have also been kind of larger scale studies that have proven that individuals living with untreated hearing loss are about 24% more likely to actually have dementia. And if we look at some statistics in South Africa, just with hearing loss, it's estimated that about 10% of the population actually present with a significant hearing loss.
Wow.
Interestingly, only 2% seek treatment, and it takes them 7 years. So they're not actually seeking treatment straight away. It's taking them 7 years.
And Elisha, why do you think that it's taking them 7 years? Is it just the availability of services? Is it that they just don't really know that there is hearing impairment, or how? What do you think?
I think it could be a combination of factors. it might be difficulty getting access to facilities, or it may also be, and what one often sees is that denial stage initially. So, you know, that kind of not wanting to go to have your hearing tested. So you do see a lot of that initially. So that sometimes takes individual, and I think it's a global thing. So it's getting them there to that appointment that does take time.
Right. And I think that, you know, we know that denial across, you know, all possible disease modalities, that does absolutely happen, where people, you know, oh, no, don't worry, it's all fine and I'm fine and
Yeah,
I don't really
I
want
don't have a problem. Or you not speaking clearly. I'm
Right.
fine, yes.
Yes, yes, and stop mumbling. I've had that many times from people who, you know, he just mumbles all day, you know.
Yeah,
But
we get a lot of that.
okay, yeah, and I think it is, you know, when you mentioned 24%. I mean, that's quite a significant amount of
Yeah.
people, you know. So you know, and I think that very often audiologists are only ever associated with hearing aids, and I think hearing aids in themselves, you know, that really is a telltale sign that you're getting old when you have to get a hearing aid. So that's why I think a lot of people avoid going to an audiologist just for that, you know.
Yeah, so there is that stigma kind of attached, which we're seeing less and less of, because I think there is a much greater awareness and technology has changed and improved over the years. But there is definitely, you know, until you get that acceptance kind of stage, they kind of feel I'm fine, I don't need anything.
Right, right, absolutely. Which leads me to the next question then, is that we also know that not being able to receive and to interpret and effectively interpret all types of, you know, sensory stimulation can lead to a lot of frustration. How do families deal with that kind of frustration when it's related to hearing?
So I think that, yes, I mean, you know, hearing loss leads to an increased level of stress and tension between loved ones. It can often lead to social isolation, avoidance. You know, you'll often find that they feel that they're left out of a conversation, or that they feel that nobody understands what they're going through. So, you know, that breakdown in communication between loved ones or between an individual and a carer often leads to kind of feelings of anger and frustration. And that's a stage that most hearing impaired people will actually go through. And they kind of feel that, you know, frustrated that maybe people expect them to be able to hear, or they're frustrated because people aren't making an effort to be able to speak clearer to them. They may feel angry that they left out of a conversation, or they've interpreted it incorrectly. And then I think also another level of frustration is that often, you know, individuals with normal hearing will often assume that if you speak louder or you increase the volume, it's going to improve their listening, but it's not always just about volume. So often it's kind of about word recognition and them understanding the speech. So it's not just about the volume. Oh, I've lost.
Karen, you're on mute.
Sorry. We touched on this earlier on, where how do families and carers know when to visit somebody like yourself, knowing that many will resist that visit?
So it's actually recommended for anyone over the age of 50 to actually have a diagnostic hearing test. But some of the signs, or some of the early signs that you may see, is an individual may struggle to be following a conversation. They will start to have difficulty following a conversation in noise. So that may be something typically that we hear. So they'll say, well, they're fine if they're just speaking to one person, but it's when there's a lot of people, or when there's a lot of background noise. What you also may find is that, you know, they start to not have difficulty on the telephone. So they might be speaking to a loved one or a child. That may be the only form of communication. And they're having difficulty on the telephone. They may not be hearing the doorbell. They may not be hearing an alarm. Then you may also notice that they might avoid certain situations or certain social situations. It does lead to that avoidance of being in that situation where they know they're going to have difficulty.
So that's quite interesting, because I think there are very, very many, we do also know that people with dementia become very auditory sensitive. So things that are too loud, things that are too busy, situations like that. So you're saying avoiding those kinds of situations is also one of those coping mechanisms where, if I get out of the situation or don't go or don't turn up, I kind of will be avoiding it, which
it becomes easier to avoid the situation than actually place yourself in that situation.
Right. So that's very, very interesting. Very interesting. Thank you for that. And Elisha, are there any non-verbal or body language indicators that can show that there's some kind of auditory or hearing problems, like changes in gait, balance, etc., etc.?
So yes, I mean, the two factors are balance. So you might find that they're experiencing kind of a little bit of dizziness, not to the extent of falling over, but they may just be having balance issues. They may be describing something tinnitus or tinnitus. So they may be describing like a kind of a ringing in the ears. That's very typical, a kind of a high-pitched sound that they're hearing. But it doesn't necessarily have to be the ringing in the ears. It could be a rushing of sound. Sometimes they might even describe it as a pulsating noise. But other kind of more subtle signs that are possibly not verbal, if you notice, you may notice that individual kind of leaning forward in a conversation. They may lean towards a particular side. They might have a dominant ear that they prefer, or that side. So they tend to prefer sitting on that side, or, put that ear towards the conversation. Some other signs that you also may notice is you may see them actually speaking louder. So they're not monitoring the level of their own voice. So they tend to speak a little bit louder. And it's another interesting point with that is you may also find that the individual tends to, it's not as common, but they may tend to dominate a conversation. So they'll talk a lot, but they're not actually listening to the conversation. It's easier for them to actually talk, so they're not actually answering any questions. They're not participating in the conversation. They're actually dominating the talking.
Oh, that's very, very interesting. That's very interesting. And I do know, I mean, I have seen it quite often in people with dementia, where they do kind of, like move forward and as you say, present a dominant ear into a conversation. So leaning into a conversation is certainly something that I've seen. And I think that if we look out for that in loved ones, it's something that is quite obvious, but only until you're alerted to it.
So it's quite subtle signs, but you may notice that.
Right. Well, thank you for that. And what are what then should families know about hearing loss in a person living with dementia? Are there any other things that somebody should know, particularly about pitch maybe, or about the tone?
Yeah. So the first factors, I'll speak about 4 factors here, but the first factor is or families or caregivers, to try and give them all the help that you can. And that is quite important. So if one can encourage them to make use of any remaining hearing that they have, I mean, especially early on, and this may be by fitting hearing instruments. But we do know that if stimulating that kind of auditory pathway is crucial, and especially with patients with dementia. So, often you find that by wearing hearing instruments, you kind of stimulating those areas, But what you're also doing is it's reducing the amount of effort that those individuals are actually using to communicate. So what it tends to do, it kind of frees up the brain in a way for them to actually focus on the conversation and then interpret that and kind of retain that information a little bit better, because they've got the added assistance with hearing instruments. But the second point is, if you consider the environment when you're spending time with individuals, and this is very, very important. You know, we know that if you are communicating with individuals in background noise or in groups of people or in crowds, for anybody with a hearing loss, it's incredibly difficult. And if you have dementia as well, it can actually become impossible in those situations, even with the best fitting of hearing instruments. So if you try and adjust the environment and you make that listening environment easier for them, that will definitely help with communication. So, you know, in the home, if you're actually spending time with an individual with hearing loss and or dementia, you know, look at the environment. Is the television on? Is it very loud? Turn the television down. Turn the radio down. You know, is there background sound? Is the vacuum cleaner on? Is there a fan on in the background? You can turn that down. They're easy things to do. You know, if you notice that there's the microwave or possibly a kettle on, wait before you actually start communicating with them. If you're actually not in their home, or let's say you're going out to a restaurant or a coffee shop, try and choose a place that's maybe a little bit quieter, maybe has a little bit better acoustics. You can place yourself or position yourself in an area that's a little bit easier for communicating. You know, often if you're positioning yourself right next to the kitchen where there's a lot of noise, that's going to be more difficult. Position yourself away from the kitchen, away from an open window if there's a lot of noise outside, or away from the table that's got a lot of noisy kids that are playing. Or, you know, it's little things like that will help in those situations. The third factor, which I think is also very, very important, and we can all benefit from that, is learn communication strategies. So learn how to make yourself a little bit easier to understand. You know, consider the way in which you're communicating with the individual. Anyone with a hearing loss is going to benefit from an individual that's a more considerate kind of communication partner. So kind of tips and techniques that you can use in that situation: look at the person when speaking. You know, make sure you're in good lighting. Make sure they can see you. I mean, I know with COVID and wearing masks, that's become a little bit difficult, but it has highlighted a lot of difficulties. But, you know, if they can see your face and you've got good visual cues, facial expressions will all help communicating with them. Try and reduce the distance. So try and get a little bit closer to them. Try and reduce the background noise, as we did discuss. And also, very, very importantly, is speak slowly and clearly. You do not need to shout or speak louder. Just speak clearly and slowly. It's not, as we said earlier, just about the volume.
Mm-hmm. I think that's a very, very important point that you raised there, Elisha. And I think we also need to understand that somebody with dementia does also have impaired concentration. So the time that you've got to actually get your message across is that much more compromised in somebody with dementia. And by the time you get to the second or third sentence, they've already lost you. So, you know, make sentences shorter.
Keep it simple.
And make it more, and make them more targeted. So that's a very, very good point. Thank you for those. Those are great.
And I think the last one that I wanted to say as well is give them a lot of love and support. I think it's important for them to know that you you are taking interest and you're there to help them and support them. And, you know, from our side with regards to that, if they are fitted with hearing instruments, show an interest in it. And it may, if you're not the primary caregiver, teach the caregiver. Learn how to change a battery so that you can assist them in doing that. Learn how to clean the hearing instruments that you can help them, or show the caregiver. Maybe know how to troubleshoot, because you don't want them to be wearing hearing instruments that aren't working. You know, go with to the appointments, ask questions. You know, nothing is going to be a silly question. It's important to show them, you know, that you are there to support and help them.
I've always wanted to know, why do hearing instruments screech at certain times? Because I've been in the company of some elderly people who really, you know,
they shouldn't be screeching.
Okay.
As an audiologist, we do not want hearing instruments screeching.
So why do they screech?
Okay, there could be a number of reasons. Firstly, you want to make sure that it's fitting properly. Okay. So if the ear may be blocked with wax, which we would need to rule out. If it's blocked with wax, you're almost getting that sound signal reverberating against a wall of wax, which creates that whistling is actually called feedback. So you want to make sure that you've got a completely clear ear canal. But it may be that hearing instrument is not fitting nicely. So if there's a more severe loss and you need a slightly more occluded fit, then you would need to see the audiologist to make sure that it is fitting well. There are ways to improve that. Maybe the ear mold is old. Maybe they've been wearing that for years and they've never had it seen to, or which it can do, shrink in size. So you would need to see the audiologist. And it also may have something to do with the hearing instrument settings. So the audiologist would need to have a look and check that.
Okay, all right. Well, that's
But it shouldn't be whistling.
Okay, yeah, no.
Or they may not have put it into their ear properly. And that it could be just maybe that they're actually not putting it in properly. Where again, if a caregiver or a spouse or a loved one or anyone that is living with the person, I often say if they just check, I always say don't do it for them, try and let them do it themselves, but you can be there to check. So often it is just a simple thing, they haven't actually put it into the ear properly.
Right, that's very interesting, very interesting. And Elisha, we're going back to the person with dementia that is in denial, that doesn't want to come to the audiologist. How does the family deal with that? And how do you, I'm not saying, how do you make it that they would want to and feel that they really need to, and that there's merit in it?
It's always difficult getting an individual to that initial consultation. I think possibly in the early stages, it's more about kind of just encouraging them to go to that appointment. You know, maybe just encouraging them that it's just a baseline. We can discuss things. It's not that you having to have a hearing aid fitted. We're just going for an assessment. Possibly in the later stages, it may be where you're actually needing to assist making that appointment or setting up that appointment for them. Go with them to the appointment. You know, don't, whether it's the caregiver or a loved one, you know, go actually into the appointment. Don't sit in the waiting room and let the individual go in by themselves. Take notes. I mean, it's always, as an audiologist, we love having a second pair of ears just listening to what we have to say. Ask questions, as we said earlier, and nothing is too silly. If it's going to help them, ask those questions. Another thing that they could possibly do is offer to have your hearing tested as well. So often we find if someone else is coming with them, then they don't feel that it's only them coming for the appointment or having the hearing tested. Test both. So it's not only them that's coming for that assessment.
They're not being singled out.
Not being singled out.
Right. Okay. That's very, very good advice. There are a couple of others. There are a couple of other pointers that we feel that are important when coming to an audiologist. And I just want to read the 5 points that we would like to encourage families to do. And maybe you can add on to these. For carers when coming to an audiologist, to make sure that they get the very best out of their visit to you, is to prepare a list of questions that you would like to be asked, and have a pen ready and handy to jot down any of the
take notes.
Exactly, take notes and any of the further tests, etc. And if there are any concerns, raise them at that point. And give the audiologist a list of the current medications or any recent infections or illnesses, and the diagnosis of dementia, which I think is quite important.
So that should come up in the case history, which is why it's important to actually be in that consultation, not just necessarily bring them to the appointment and wait and sit in the waiting room, but actually come in. So you're there when they're doing a case history, when they're discussing things, because things may come up in conversation or while going over the hearing test results or explaining things to the individual.
Right, absolutely. And then if necessary, bring a friend or a family member to take notes, and to keep your loved one busy. I mean, if there's real anxiety around going to the appointment, and if needed, write down any follow-up tests or any treatments. Is there anything that you would like to add from an audiologist that you would also recommend for families to consider, or loved ones to consider when they bring their loved one to a person like yourself?
I think we've covered most of it. It's not a scary thing coming to the audiologist, and most audiologists are very compassionate and are used to dealing with individuals with hearing loss and dementia. So, we hope to make them feel at ease, the individual as well as the person or friend or family member that's with them. We're happy to answer questions. You may also get questions afterwards or that get forgotten. So we're happy to answer those afterwards. They can email us or they can phone us afterwards. But it's not scary or anything to worry about when you visit the audiologist.
No, well, I must say that they start them at a very young age, even at preschool, foundation phase, and primary school, where they actually do, hearing screenings and things like that. So
it's actually with newborn babies, is that all newborn babies are actually should be tested before they leave the hospital. So it is actually, yes, a global, there's newborn hearing screening. So
that's amazing. That's a new thing, because I don't remember my children having that.
No, I don't think, not possibly then, but it is something that is being done at the moment. So almost all newborn babies would have their hearing tested before they leave the hospital.
That's amazing, because I would imagine that it impacts in a number of different disease profiles. I mean, autism and a number of others, would possibly also present in those kinds of screening.
And also early detection. So that's also
quite sensitivity to hearing. Yeah. Elisha, it's been so enlightening chatting to you. And I really know that, all our YouTubers and our Facebook lovers and our virtual support group will really enjoy this visit to the audiologist and to yourselves today. So thank you so much. Thanks for sharing, and thanks for your time. It's been wonderful. Thank you.
Thank you very much. If there is anything or any questions that come up, I'm happy to answer. You can email me or let me know.
Fantastic. I think we'll pass them through the Dementia SA office, and we'll send them to you sort of in one batch. But thank you so much for a very enlightening session. Thank you.